Did you know that 25% of how long you live is based on your genetics? So that means that 75% of how long you live is really dependent on your lifestyle. Research shows that the human has two different types of ages. We have the chronological age, which is actually your birth age. So that's how many years you've been alive or on this planet. But then you also have the biological age, which is really your body age. And your body age is dependent on different lifestyle habits. It's affected by sleep, by exercise, by lifestyle changes, by stress factors. Different things can really determine what your biological age is, and that's how your body is responding to different activities. And what you'll find is some individuals may have a much higher biological age than their actual birth age, which means that they are at risk for other kinds of communicable or non-communicable diseases, as well as different things that can cause them to age at a much faster rate. So for example, my biological age is actually 36, but my birth age is 40. So that means that I'm actually below my actual birth age. But we do find that there are many individuals that actually have a much higher biological age. So what we'll be doing over the next 12 weeks with Spry In is we are going to have 10 volunteers that are going to share their experiences with us. They're going to do a series of tests and assessments with different experts, physiotherapists, trainers, coaches, psychotherapists, as well as medical doctors and different specialists who are going to now analyze, look at the data, and see what is the actual biological age versus the birth age currently, and how can they either reduce it or extend it. So you're going to join us with Spry In and everyone else on this journey, our 10 volunteers, as we see if we can actually reverse the age process. Okay, hi guys, so I'm here with Renee and Lennox McLean, and they're also participating in our 12-week experiment. So I want to find out from both of you, where did you hear about this and what made you decide to participate?
Okay, so hi Naomi. So I heard about it from my husband Lennox. He follows Spry on social media, and I think we basically wanted to partake in the activity so we can, get a better idea of what's going on with our body and try to see as best as possible how we can ensure that we are living our best lives, basically. So I have a family history of cancer and diabetes, also hypertension, so I just want to see what I can do to improve what it is that will ensure that I live a longer life.
Okay, and tell me, what are your birth ages and what do you think your biological ages are right now?
Well, I'm 36, and currently I believe I'm probably 36 because I'm a little bit overweight at the moment.
I'm 51, so I think maybe my biological age maybe about 48, 47, thereabout.
Or probably a little bit younger, actually. He's in pretty good shape.
Awesome. So tell me, what are your overall expectations from this experiment?
Well, for me, I just want to understand my body a little bit better and get the knowledge in order to improve on my day-to-day activities.
All right, so I'm here with Renee Campbell. She's another one of our participants, and we're going to find out a little bit more about Renee. So Renee, I want to know, what made you want to be a part of this experiment?
Well, in the last, I'd say 6 months or so, I noticed that I started to gain additional weight. It could be COVID. I stopped doing as much exercise as I was trying to do. I slipped off the wagon with the dieting as well, more sodas and everything, and increased pressure at work. And I saw an opportunity to work with Spry, and I just think that it seems to be one of the cooler gyms that would really push you to another level, and I just thought to give it a try.
Awesome. Yeah. So tell me, what is your actual age and what do you think your biological age is?
Well, I'm 34, and given the recent practices, I'm going to exaggerate and say about 60. Okay. About 60 years, yeah.
And if you could take a guess of what your biological age is?
It's going to be high because I have the extra weight. Yeah, so I know it's going to be higher than it should be.
And tell me, what is your actual age and what do you think your biological age could be?
So actual age is 43. I am hoping that they'll tell me my biological age will be somewhere around 43. I suspect right now it may be a bit higher. It may be closer to 50.
So hi guys, we're now at test station number 1. This is the first test that we're going to be doing as we do this documentary, and it's about testing for your height and your weight. So I'm here with Dr. Harvey, and she's going to share with us why is it important that we start first with getting the accurate measurements for your height and weight. So Dr. Harvey, tell us. Why are we doing this first?
Okay, so we use parameters such as the height and weight and other anthropometric measurements to assess their risk factors for the development of heart disease as well as stroke.
Okay guys, so we're here at test station number 6 and it's all about body fat. So I'm here with performance consultant Jay and I'm also here with Dr. Rodane Ruddock. So we're going to hear what is it we're really testing for body fat and why is that critical to what we're doing here today?
Okay, good question. The thing with body fat, we don't want to get into the specifics, but think about the body BMI. Everybody know what the BMI means.
What is the BMI?
So it's a body mass index. It's the mass per meter square, right? So it's mass measured in kilogram and height in meter square. And essentially, what this does is it gives us an indicator of how well the patient is doing in terms of muscle to fat ratio. We usually want a higher ratio of muscle than fat, and that has implication on the cardiovascular system, positively or negatively. Now with these patients with a BMI lower than 25, studies have proven time and time again that this decreases their cardiovascular risk significantly. So it means that your BMI less than 25 essentially decreases your risk of a stroke and a heart attack. Also, from the more mechanical aspect, increased BMI causes increased fat because of the increased fat and mass on the body. They have increased joint pain, increased lower back pain. So those are some of the things that we have to look out for in terms of the BMI and body fat percentage.
Okay, great, thank you. So Jay, to me this sounds like what we have to be doing is, based on the assessment, is trying to reduce the body fat or reduce the BMI for each patient depending on their situation. So tell us a little bit more about that.
Okay, so to reduce body fat is very important. Males generally you want them to be below 25% to not be considered over, and females generally not over 32%. But there's another study that links to body fat for males between 7 and 14%. So that's the ideal range or optimal range that we should be going for, and this again reduces risk. So for the actual body fat test, we're measuring the adipose tissue with a caliper. So you're measuring in millimeter at 12 different sites around the body. And these 12 different sites goes into a software that then works out what the exact body fat percentage is.
Okay, so we're now here at station number 2. This is the pressure station, and I'm here with Dr. Harvey, who's going to explain to us why is taking your pressure important and what are we looking for as we measure each individual's pressure.
Okay, so it's important for a patient to have regular normal blood pressures to reduce their cardiovascular risk and their stroke risk as well. And also their risk for developing high blood cholesterol, kidney problems, and diabetes. So having a good blood pressure will reduce your risk of developing such.
All right, guys, so we're now here at test station number 7, and I'm here again with Tony, and Tony's going to explain to us what's happening here at the sit to stand test station.
All right, so scientists developed this test to see how well we are aging and accurately predict how long our lifespan will be. So what this is testing is our muscle strength and flexibility and also balance. Because as we age, the strength gets less and our balance is way off. So in this test, they're crossing their legs and they're just sitting as best as they can. The score is marked out of 10, 5 for each sitting and then standing. 1 point is minus every time they use a hand or a leg, or if they wobble, a half a mark is subtracted. As we age, we lose the strength within the hand. So this test is actually to test the grip strength.
Squeeze as hard as possible. Squeeze. Squeeze. All right, release. Okay. And there we go. So this is for the front.
Okay guys, so we're at station number 5, and this station is all about nutrition. And if you go to the gym, you hear all the time that you can never out-train a bad diet. No matter how often you go to the gym, no matter how many pull-ups, sit-ups you do, you have to also maintain a good diet. So that's where nutrition comes in. So we're here with Jay, performance consultant again, and he's going to share with us why is nutrition so important for this process.
Right. So nutrition is critical. So we're getting all calorie information, all macronutrient information, because you could have the right amount of calories, but you're having the wrong protein amount and the wrong carbohydrates amount, which is going to change your body composition. Nutrition is very complex, and what they're doing here at this station is basically going through a log of the person's nutrition over the last 5 days, including weekends, because persons tend to eat different on weekends. You laugh. But yeah, persons' weekends normally shift from what they do in the week. And persons maybe sometimes have a great week of eating and they mess it all up on the weekends by having too much.
This is Renee Campbell, and we're going to look on her charts to see what her assessment today revealed, so we'll know how to proceed over the next 12 weeks. So again, we have Jay and we have Dr. Harvey here to share some of the results with us. Dr. Harvey.
Okay, so upon assessment, she has a BMI of 35, which puts her in the obese category. However, on reviewing her blood results, the only abnormality is in her CRP value, which is elevated. Now, she had said to me that she has no family history of any chronic medical illnesses, and no medical illnesses is found within her personal history.
Okay, so her age is, well, that's her markers. As Doc spoke about already, it's just CRP that is out of range, and we'll move on to what her actual age is. So her birth age is 34 years old, but as she's functioning now, based upon her lungs, her heart, and her muscles coming together, she's actually 75 years old. So her VO2 max score was actually quite low, which was one of the biggest indications. Her activity levels as well. We have to work on this right away.
Renee, so you've heard what Jay had to say, you heard what Doc Harvey had to say, and you've seen the results for yourself. How are you feeling, and how does that make you feel now going into the next 12 weeks?
It's alarming, but I'm at the right place.
Yes.
You know, there's a lot to look at. Once I heard about the body mass index and the CRP, that is way out of range. I know there's something to look into. I know it's that, it may have to do with work stress. You know, so those are just sleep, to look at, to work on.
Jay, are we ready for the results?
Yes, we are. So Bianca's birth age is 43 years old currently. However, her biological age, this is the age that her body is aging, is 62. All right, so we got some work to do. As we stated before, we want the age to be below the chronological. We want what's happening biologically to be below. At least. So, yeah.
Thank you, Jay. How do you feel, Bianca, now that I know we had a discussion earlier in our little meetup, right? But now that you've seen the actual biological age, how are you feeling?
I'm surprised it's as high as it is, but bearing in mind the stresses my body has been under for the last couple of years, in particular with my injury and the surgeries and so on, I'm not too surprised. So I am looking forward to reducing that significantly.
All right, so are we ready for the reveal?
Yes, we're ready for the reveal, Naomi.
Right.
So his body age, no, not his body age, his chronological age, which is his birth age, is 38 years old, right? 38 years old, yeah. All right, so based upon how his body is functioning and his heart and his lungs and his muscles are working together, his biological age is 71 years old. Of course it's real. This is based upon your VO2 max gas exchange. Your biological age is...
Wow, you're kidding me.
No, we're not kidding you. Right now, her body is moving like an 86-year-old. All right, so for Mr. McLean, his body age is... All right, so that's his birth age, sorry, correction. That's when he was born up until now. That was a bit of a shock, all right? And Mr. McLean's biological age is?
56.
56, so not bad. Not bad.
Lennox, how do you feel about that?
Well, I feel good. Yeah.
Yeah? Renee, how are you feeling over there? So I'm going to speak to Jay to see what he has to say about the results, but I want to know how you feel before we actually get to your age.
Well, I'm a little bit nervous because after Lennox got 56, he's 51, I'm assuming I'm probably 10, 20 years older. So I know I have a lot of work, so I'm a little bit anxious to see what the results are.
Well, let's hear what Jay has to say. Jay.
Let's look at her actual age. So her birth age is 36 and her biological age is 47. All right, so she's got a little bit of work to do. Ideally, we want to have a chronological age in line with biological age or have a biological age below a chronological age.
Thank you, Jay. So Renee, now that the results are in, you actually predicted that. You said that you believed it would be maybe 10 years over. How do you feel?
I think it's within range. I can actually do some work, continue for another couple of months to get my weight within the normal range, and hopefully when we retest, I'm 36 or younger. So we'll see.
Awesome. Thank you, Renee.